Most people think Shaolin Monastery Kung Fu is about discipline, balance, and flashy forms performed for tourists. That's the myth. The truth? Hidden inside the original combat teachings of Shaolin Monastery were techniques so surgically precise, so biologically destructive, that they were never meant for public demonstration. Not because they looked brutal, but because they worked. Some of these methods were labeled forbidden, not mystical, not magical. Forbidden because they targeted the body's electrical system, the nerves controlling your diaphragm, your carotid sinus, your cardiac rhythm. One precise impact in the wrong place doesn't just cause pain. It disrupts blood flow to the brain. It hijacks the vagus nerve. It can trigger sudden cardiac arrest. This is not a list of flashy moves. This is an anatomical breakdown of 5 Shaolin combat techniques designed to shut down the human body at its control centers, explaining exactly what they hit, what nerve or artery is affected, and why, in the wrong hands, they could quite literally stop the heart. Let's expose what was never meant to be taught. 1. Xing Ko Jiang, Heartmouth palm strike. The hook. A single concussive palm to the sternum can drop someone before pain even registers. Historical context, brief. Combat traditions linked to the Shaolin Monastery describe close-range palm strikes used when weapons were lost and distance collapsed. These methods weren't designed for sport or demonstration. Modern competition bans intentional full-force cardiac strikes because of the rare but documented risk of fatal arrhythmias. The anatomical breakdown. The strike lands over the lower sternum, directly above the heart. The danger is not crushing the organ, it's disrupting its electrical rhythm. A sudden, blunt impact during a vulnerable millisecond of the cardiac cycle can trigger commotio cordis, causing ventricular fibrillation. Impact to electrical instability in myocardial cells, to chaotic rhythm, to ineffective pumping, to rapid oxygen loss to the brain. Even without perfect timing, cardiac contusion, sternal fracture, and intense vagal stimulation can produce bradycardia and collapse. The mechanism is mechanical force interfering with cardiac electrophysiology. 2. Dian Shui, carotid sinus press. The hook. A precise strike to the side of the neck can switch off consciousness almost instantly. Historical context, brief. Neck strikes were tactically effective because arteries remained exposed even when armor protected the skull. Variants of Dian Shui focused on targeting vulnerable anatomical cavities. Today, regulated combat forbids direct carotid strikes due to stroke and cardiac arrest risk. The anatomical breakdown. The carotid sinus contains pressure-sensitive baroreceptors that regulate heart rate and blood pressure. Sudden compression overstimulates these receptors. Baroreceptors misread impact as extreme blood pressure leads to signals travel to the medulla, leads to vagus nerve activation, leads to sharp heart rate drop, leads to blood pressure collapse, leads to decreased cerebral perfusion, leads to blackout. Severe trauma can also cause carotid artery dissection or clot formation, increasing stroke risk. The body essentially shuts itself down because its pressure control system is violently disrupted. 3. Feng Fu strike, wind mansion blow. The hook. A blow at the base of the skull can interrupt breathing before the victim hits the ground. Historical context, brief. When helmets shielded the face, fighters targeted the gap beneath the occipital bone. The Feng Fu region was considered lethal because of what lies beneath it. Modern rules universally ban strikes to the back of the head due to brainstem vulnerability. The anatomical breakdown. Under the occipital bone sits the medulla oblongata, the control center for respiration and cardiac rhythm. A sharp upward strike creates hyperextension at the atlanto-occipital joint, C1 to C2. Shearing force leads to brainstem concussion or compression, leads to disruption of respiratory and cardiovascular regulation, leads to immediate neurological shutdown. Severe trauma can fracture cervical vertebrae or compress the spinal cord, potentially causing paralysis or loss of autonomic control. This area governs survival reflexes. Damage here is often catastrophic. 4. Tanjong spear hand, central altar thrust. The hook. A focused thrust to the center of the chest can steal the breath in one violent second. Historical context, brief. Tanjong refers to a central sternum point referenced in traditional systems. In combat context, it was targeted for structural disruption, not mysticism. Direct spear hand thrusts to the sternum are banned in sport fighting due to internal injury risk. The anatomical breakdown. The strike drives force into the xiphoid process at the base of the sternum. If fractured inward, it can damage the diaphragm or underlying liver. Xiphoid trauma leads to diaphragmatic spasm, leads to inability to inhale, leads to rapid oxygen deprivation. Severe impact may also cause internal bleeding or pneumothorax if surrounding tissues are damaged. The effect isn't supernatural. Its respiratory mechanics violently interrupted. 5. Supraclavicular elbow, brachial plexus descent. The hook. An elbow into the hollow above the collarbone can overload the nervous system instantly. Historical context, brief. On elevated fighting platforms, close-range finishing strikes were decisive. The supraclavicular region was valued because it houses major nerves and vessels. Modern combat sports prohibit deliberate attacks here due to risk of nerve destruction and vascular rupture. The anatomical breakdown. The supraclavicular fossa contains the brachial plexus, nerve roots controlling the arm. A descending elbow compresses this neural bundle. Blunt force to intense neural shock, to temporary motor paralysis, to overwhelming neuropathic pain. Deeper trauma can rupture the subclavian artery or puncture the lung apex, potentially causing rapid hemorrhage or tension pneumothorax. The shutdown effect comes from concentrated trauma applied to a dense neurovascular junction. These techniques are not mystical secrets. They are examples of how targeted trauma to critical anatomical structures can cause rapid systemic failure. Knowledge like this changes how you see the human body forever. What most people call strength is an illusion. Underneath muscle and confidence lies a fragile electrical system. Nerves, arteries, reflex arcs, all balancing on milliseconds of stability. These techniques were never mystical death spells. They were precise understandings of biology, weaponized. And once you understand that, you can't unsee it. Every movement becomes anatomy. Every strike becomes physics. Every body becomes vulnerable. But this level of knowledge isn't for everyone. Most people prefer the fantasy version of martial arts. Flashy kicks, safe rules, controlled environments. If you're still watching, you're not most people. Subscribing isn't about joining a channel. It's about stepping into a smaller circle. the few who can handle the raw mechanics of real combat without flinching. And if you think this was dark, wait until you see what ancient battlefield grapplers did to joints when armor made striking useless. That video will change the way you look at pain itself.